Gastrointestinal organs are going to be composed of four layers, which are also called tunics. So from deep to superficial, the tunics are the mucosa, which is the inner lining epithelium that comes in contact with the foodstuffs. Submucosa would be the next layer, which is a type of connective tissue. It's usually areolar or dense, irregular connective tissue. The third layer is the muscularis layer, which is an inner circular layer of smooth muscle. This circular layer of smooth muscle is going to constrict the lumen and form constrictors, or sorry, sphincters at some locations. A sphincter is basically a circular ring of muscle. And these specific sphincters are going to be located between different regions of the GI tract. For example, there'll be one between the esophagus and the stomach, one between the stomach and the small intestine. The next layer of the muscularis layer is the outer longitudinal layer, which is smooth muscle as well, and it's going to shorten the tube. The outermost layer then is called the adventitia or the serosa. The adventitia is made up of areolar connective tissue with collagen and elastic fibers, and the serosa is going to be used for primarily the peritoneum, which is in the abdominal cavity. This diagram is showing those layers or tunics of the abdominal GI tract. So the epithelium is going to be the mucosa. The innermost lining comes in contact with the foodstuffs. The next layer is called the submucosa. The muscularis is going to have the two layers, the internal circular layer and outer longitudinal layer. There's also going to be a nerve plexus called the myenteric nerve plexus, which is located within the muscularis layer. And then finally, the serosa, because this is showing the abdominal GI tract specifically. If it was the thoracic GI tract, like the esophagus, we would have the adventitia instead of the serosa. There are three unpaired arteries that supply the abdominal GI tract, and they include the celiac trunk, which has been discussed before, the superior mesenteric artery, which is going to deliver blood to the small intestine, the inferior mesenteric artery, which is going to deliver blood to the large intestine, and the celiac trunk is delivering blood to the stomach, the spleen, as well as the hepatic portal system. Our next slide is showing us some of the lymphatic capillaries that are going to be associated with the mucosa of the GI tract. Remember, they are called lacteals, which are sort of modified lymphatic capillaries, and they are found in the villi of the small intestine. Villi kind of look like curved structures that are extensions of the simple columnar epithelium. The lymphatic vessels transport this lymph to the cisterna chyli, which is basically the entrance point of the thoracic duct. So remember, these are called MALT, which stands for mucosa associated lymphoid tissue. And in the small intestine, there are also nodules of aggregated lymphoid nodules of the ileum, also sometimes referred to as Peyer's patches. So let's look at the histology of the esophagus. The esophageal mucosa is going to be stratified squamous epithelium, non-keratinized, of course, and that's going to, again, be in case there's any abrasion that occurs because of food that we have swallowed. Maybe we've had something too acidic or too hot, and that's damaged the superficial layers of the stratified squamous epithelium. The muscularis contains both skeletal as well as smooth muscle. And this means that there is voluntary control and involuntary control. The skeletal muscle is voluntary control of swallowing, and that's going to be located superiorly to the smooth muscle, which is inferiorly. So the superior esophageal sphincter is a ring of skeletal muscle at the top of the esophagus, and this closes during inhalation, preventing air from going into the esophagus. So the inferior region of the esophagus is smooth muscle. So there's an inferior esophageal sphincter, also called the cardiac sphincter, because it's close to the heart, and it's a ring of smooth muscle at the bottom of the esophagus. And this prevents materials from regurgitating from the stomach to prevent things like acid reflux from happening, preventing the acid from the stomach from going in a superior direction into the esophagus. This slide is showing the histology of the esophagus. So you can see shown on this diagram the oropharynx and laryngopharynx, the superior esophageal sphincter, which remember is skeletal, and then shown is the esophagus, inferior esophageal sphincter, also called the cardiac sphincter, and it is smooth muscle, so it is involuntary. On the right-hand side of the diagram, we see some histology showing the esophagus. The inner layer of it is the mucosa, then the muscularis mucosa, submucosa muscularis, and adventitia. Remember, the muscularis has two layers. It has the circular layer, and it also has the longitudinal layer. Looking now closely at a region of the mucosa, we see stratified squamous epithelium, which of course is non-stratified. This is showing the mucosa region. At the base of the mucosa is the muscularis mucosa. And this is going to change now as we start to look at the stomach coming up. In the stomach is located in the upper left quadrant of the abdomen. This is where the bolus eventually is processed into chyme. It's the location where fat digestion begins. And then, protein digestion begins here in the stomach, and fat digestion begins in the small intestine. So the beginning of the stomach, the entryway, is called the cardia. It meets the esophagus at the opening called the cardiac orifice. The fundus is the dome-shaped portion of the stomach. The largest portion is the body, and the end of it is the pylorus. So this is showing a diagram of the stomach. You see the esophagus with the cardia, the fundus, body, as well as pylorus. The pyloric sphincter would be at the distal end of the stomach, and it would enter into the duodenum. As far as the histology of the stomach, what we see here is that it's lined by simple columnar epithelium. So going from the esophagus to the stomach, we go from non-keratinized stratified squamous epithelium to simple columnar epithelium. The lining of the stomach is indented by depressions called gastric pits. At the base of each pit is a specific gland called the gastric glands. So when we look a little closer at this diagram, we see the four layers of the GI tract: the mucosa, submucosa, muscularis, and serosa. The mucosa has the simple columnar epithelium. And notice that it begins with a gastric pit, and this gastric pit then at the base of it becomes a gastric gland. So the gastric gland is this region right here at the base of the gastric pit. The stomach also is going to have three layers of the muscularis. In addition to having the circular layer and the longitudinal layer, it has an oblique layer. It's the only part of the GI tract that has an oblique layer, and it allows for continued mixing. So mixed contents happen here.